Hi, my name is Dr. Brian Gruber. I'm founder of Integrated Orthopedics, and today we're going to talk about rotator cuff tears and the need for tissue augmentation. Tissue augmentation in orthopedics is typically when we have deficient tissue or not enough tissue, and we need to make a construct stronger. We know based on the research as we mature, the quality of our tissues does diminish somewhat. In the rotator cuff, at the age of 65, for example, we begin to see some decrease in the heal rates. Therefore, we're more apt to augment tissues over the age of 65 if those folks were to undergo a surgical procedure. The vast majority of rotator cuff injuries that are treated surgically are treated without tissue augmentation. So somebody will tear their rotator cuff, fail conservative treatment, or say maybe you have a younger person and you end up going right for a surgical situation. That tissue is typically strong, of good quality, and we can repair that tissue right back down to the bone. So the majority of cases, there's no requirement for a tissue augmentation or a graft. However, a couple instances in which someone may need tissue augmentation would be as follows. One case would be somebody who has failed a repair. So they either have a re-tear or maybe their tear did not heal, and you are concerned about, if you're going to go back in for a second operation, you want to do everything you can do to optimize the situation or the environment, and that would be one indication for tissue augmentation. The second indication would be somebody who may have a chronic tear, or when you get into the shoulder, the tissue quality is not optimum. And that would be a situation, again, where you would put tissue on top of the repair to sort of strengthen it or augment the repair to help get a better outcome. This can be first-line treatment if somebody has a massive rotator cuff tear, or if their tissue quality just seems to be poor. When you get in there and you really feel that you need to augment that tissue to make it stronger, that can be first-line treatment. So with the tissue augmentation, clearly everyone wouldn't be a candidate. So if we have say a younger person, maybe in their mid-40s, that fell off a ladder, that tore their rotator cuff, young and healthy, we would typically not need to augment that tissue, and usually that does not come up in the conversation. That'd be very unusual. However, if somebody has a revision or a second-time surgery, or if they're of advancing age and we're concerned about the possibility of tissue quality being an issue, then we'll have that discussion with the patient in the office, obviously in the preoperative setting as well. And basically, it's that we're going to have this capability. We'll have the tissue available. So if we need to augment the repair, we can, and we have the consent of the patient to do that. So we're definitely prepared to do that with all those cases. And if we need to, then it doesn't change the surgical strategy. You just fix the rotator cuff and then put the patch over the top. How we do it is with a piece of cadaver skin, and it's very interesting. The studies have shown that it increases the construct repair strength by about 35%. So one logical question may be, why don't you just do that for everyone? And the reason we don't is it does add significant expense to the operation. Is obviously technically more challenging, and it's more interfaces to heal. And what I mean by that, when you repair the rotator cuff, a primary repair, you repair the rotator cuff to the bone. And think of it like, so say we're making the bed. The tissue augmentation is in the patch over the top. So what we do, think of like the comforter after you've made the bed. So that's another interface that has to heal. So you, number one, have to get the rotator cuff to heal to the bone, and then you have to get the tissue on top to heal to the rotator cuff. So it's more interfaces to heal, and we have to go slower. So we wouldn't augment everybody's tissue for those reasons. We've done many tissue augmentation procedures, and we've done these. At this point, we do them all arthroscopically. Earlier on in the learning curve, you're doing the open procedure, so you're going to make a small open incision, so you can really see what you're doing to get a very good outcome. As we become more facile with the procedure, we have this down through the scope. So a tissue augmentation procedure would typically take about 2 hours, which would include repairing initially the rotator cuff and then putting the tissue on top of that rotator cuff repair. The recovery time is a little bit slower. So again, with the interfaces to heal, we will. I'm not going to say it's double a regular rotator cuff repair, but it probably adds on a third from a time standpoint. So we go slower with active motion. So I keep people in the sling for 8 weeks typically. We're getting them into physical therapy, but it's for passive range of motion only. The therapist will move the arm, but the patients won't activate their muscles. Therapy for a tissue augmentation procedure is usually about 4 months. The success rate's very good. These are oftentimes very complicated situations. Maybe it's a second or third time the patient's had rotator cuff surgery, or again, you're taking somebody that's a bit more mature, over 65. So these are cases that are a little more challenging from the outset. We get very good results, but we feel that we need to augment this tissue to get the better outcomes. Tissue augmentation is tissue augmentation's been around for a while. It is technically challenging, specifically to do it arthroscopically in a timely manner. So I think from a cutting edge standpoint, that part of it is cutting edge to be able to do it all arthroscopically. With tissue augmentation, we feel that we're able to increase the strength of these repairs significantly. We feel that for somebody, for example, if you have a failed rotator cuff and you're going to go back in there, with all things being equal, you want to try to change the outcome. We want to make sure that we don't get the same outcome of something not healing. So we really want to optimize the environment, and the tissue augmentation procedures really allow us to do that and allow us to give our patients the best possible outcomes.